I want to talk just for a minute about preparing for different types of medical problems. Today I want to talk about bladder or urinary tract infections. This may not be something you've given a lot of thought to, but they are very common. Your body becomes more susceptible to these if you're dehydrated, which definitely could be a problem in a SHTF situation. These things can become extremely painful, and if they're left unchecked, you can urinate blood, and it can just cause more problems, and it would have to be treated by a doctor at that point with prescription medication. This is definitely something you should plan ahead for, and if you catch it early, you can head it off with just general over-the-counter medication. You'll know if one of these is coming on if you feel like you have to urinate constantly, and a lot of times you'll try to go to the bathroom and you won't be able to. Or when you try to urinate, only a little bit will come out, but you'll still feel like you've got to go when you're done. If you start feeling this way, you should go to the store and buy yourself a medication called Azo, A-Z-O. It's an over-the-counter medication, and what it does is it takes the pain away and takes the feeling of urgency away. You're also going to want to buy yourself some echinacea with golden seal. This works like an antibiotic. You're going to want to take high doses of it multiple times a day for several days to help clear up the infection. You're also going to want to get cranberry juice, which will help clean out your urinary tract. If you can't get cranberry juice, cranberry pills will also work, but you're going to have to take high doses of those as well, and you're going to want to find pills that have the highest amount of milligrams of cranberry that you can find. If you take this concoction for several days, you should be able to clear up the infection on your own if it hasn't gotten too far. This is definitely something you're going to want to be able to address quickly in a SHTF situation if you cannot see a doctor. I've had these before, and they can be very, very painful. So I hope you'll think about adding these things to your preps. It's not something a lot of people give a lot of thought to, but they are pretty common. Azo, echinacea with golden seal, and cranberry pills. I hope this helps, and always ask yourself, will you survive?